All right, Cinco de Mayo, May the 5th. We're doing Embrace radio frequency face tight on a patient here. We placed in the tumescent fluid, so she's quite numb. And we're just heating up the fluid by placing this tuning fork right here. It's very thin probe, it's very, very thin. It just goes in through a very, very small opening. And then constantly measuring the temperature between the two probe, and basically embracing the skin to a certain temperature that we know works to tighten the skin. And also it's tightening, also it's melting a little bit of the fat underneath. So it facilitates our the liposuction component of it. So there's definitely two parts here. For some patients, it's all about more tightening the skin. For some patients, it's tightening the skin plus reducing down a little bit of the fullness. So she has a little bit of fullness here. So following the embrace component, part one, which is to tighten the skin, part two would be to do a liposuction or liposculpturing to make sure that we take as much of the fat out and really try to keep her, give her a very, very nice, tight jaw, delineation of the jaw, as well as the neck area. Okay? All right, that's it. All right, so Cinco de Mayo, this is part two. We had just completed the Embrace radio frequency face tightening to tighten the skin and to melt some of the fat. Now, this is the most important part. The Embrace itself is not gonna sculpt out the excess fullness here. It really, really is important that the person doing this procedure understands how to sculpt the fat out safely and effectively. So you need to seek, when you do get the Embrace face tight, you really need to go see somebody who has a lot of experience in liposuctioning and understanding how well they can remove the fat here. So basically, the Embrace technique helps with how the surgeon can effectively improve here, not just in terms of sculpting out the fat, but also concomitantly at the same time, tighten the skin. That was not a procedure that's available before. When we used the smart lipo, it was all about melting the fat effectively to take the fat out, but it didn't do much in terms of really tightening the skin. It did tighten the skin a little bit because it had a 1320 nanometer. As far as the smart lipo was concerned, the 1320 was all about tightening the skin. But the Embrace radio frequency does really, really a much more effective job. So for patients who want the fat removed as well as to tighten the skin, there's really no other better technique. But the caveat is find a physician, a surgeon, who doesn't just only has learned how to use the Embrace technique well, but also needs to know the second component of this procedure, which is to really, really suction out the fat effectively and well. And that's something that takes long, long years to really perfect in terms of really knowing how to do that well. Okay, that's it. All right, so this is part three of our Cinco de Mayo patient. The first part was how we use the Embrace radio frequency system to tighten the skin. Second part was to make sure that we sculpture the fat that she has accumulated underneath her neck and around the jowl and the jaw area to achieve a better delineation. And the third part now is to make sure that we get a good lifting of the skin of the mid-face area, the jaw area, as well as the neck area using a threading technique. So basically using these latest technology and combining it with the traditional liposculpting of the neck and the jaw area, we can achieve almost something that's almost comparable to a traditional facelift surgery and neck jaw lift surgery without the downtime. As you can see, there's very little bruising, there's a little bit of swelling, and all these markings are very important markings for us to follow directions and so forth. But it's really, I think in this day and age, there's so many technology available out there. There's so many machines out there, and patients don't know what to choose from. And basically, it's not the machine, it's not the technology that achieves great result. It's the utilization of the latest available technology to facilitate the surgeon to achieve a better result, maybe perhaps using minimally or non-invasive technique, and allow the patients to recuperate quicker. Her mandate was that in a week or so, she has to travel and see her family up in Canada, and she'll be in June going to her son's graduation. So she's very, very busy, and she cannot take like 2, 3, 4 weeks out to recover from a traditional long flap facelift. So here, there really is no scar. There's a very, very small puncture wound right here. You can barely see it. It's maybe half a millimeter, maybe 5 millimeter or so, and another 5 millimeter opening here, and just a small little opening to allow 2 threads to go in. My preference by now is for 2 threads, and I just want to show what the thread will do. Embrace radiofrequency alone would have done a decent job of tightening the skin, but I'm not so sure if it would have lifted the skin this much. I'm going to make sure that I can lift the skin by using the threading technique, by combining it. It's always synergy of using various different modalities, and I believe in that. So just one procedure will achieve this one thing, right? But if you can combine 3 different procedures to achieve something greater, I'll always be going for that right formula. So this is the threading for the neck. Okay, so we're going to create just a little bit of delineation of her carotid angle area here, and just make it look just a little more sharper looking along the jaw. Okay, and this is along the lower face, the jawline area. Right here, okay, along the jaw area and along the jowl area. And of course, everybody wants to improve upon the nasolabial area and a little bit of the marionette line as well too, and that's what this does. So yeah, argumentatively, the patient could have just opted for embrace liposuction and wear the corset for a prolonged period of time, but I think this way, the threading will make sure that the skin stays nicely coaptated and lifted up, really facilitating the embrace part of the procedure and the liposuctioning part of the procedure to heal even better, which is ultimately we want to work against what the gravity has done and bring everything up. So the point of this video is, when you go see a surgeon, make sure that he understands what all the latest technology is about, and most important, make sure that he understands how to incorporate that technology so that he can do a better job. And foremost, please understand that it's not the technology itself that replaces surgery. It gives a good surgeon, a good anatomist, an option to utilize these latest technology to do even a better job with the shorter recovery time. Okay, thank you. Okay, so we have our patient here, May 5th, Cinco de Mayo. Basically, what we did was we went ahead, and her main concern was the fullness to the neck and the jaw area. She wanted a better delineation of the jaw. And just like a lot of women who go through pregnant period, they gain a few pounds, and sometimes it's difficult to remove it all. And she's noticed that over the years, her lower half of the face just got heavier and heavier, and she didn't like the fact that she no longer had a nice, clean delineation of her chin and the jaw area, the submental jowl area. So what we did was we utilized the technique where we used embrace radiofrequency face tight to tighten her skin, and then we used traditional liposuction to suction away the fat. And that wasn't enough for us. We wanted to achieve even a better result. So we went ahead and we gave her thread lifting. So between the combination of the in-mode, the face tight technique, the liposuction technique, and the actual thread lifting, she probably got a result almost comparable to a traditional facelift without the recovery period that's required, which is usually in terms of 2 to 3 weeks or so. And she's got important things to do over the next week and over the next 1 month, so her recovery had to be minimized. So this is a good option for her. So let's go ahead and Mimi, can you come over here and come over to the other side? Come over to the other side and just hold on to this picture. And I'm gonna flip over to the other side, and I'm gonna show. We still have the thread in there. So as you can see, the fullness. Let's go ahead and show the fullness is much better. Can you come turn around? And yeah, actually you can stay put here like that. Can you come around and show the side view? How the liposuction and the embrace has done an amazing job to achieve a more crisp appearance between the chin and the neck. A much improved delineation of the jaw. And by the way, because the embrace technique is so advanced, there's really minimal bruising and almost minimal swelling. Let's go ahead and show the other side as well too. Come turn around like this. And once again, compared to here, let's go ahead and show this picture. Compared to this picture, there's a much better delineation of the jaw and neck line. Okay? All right. So now, what we wanted to do was to achieve even a better result. So let's go ahead and show right here. Okay? Can you show this picture? And this upper thread lifts the midface. The only thing that mimics actual surgery in terms of mechanically lifting the tissue is thread. Everything else works at a molecular level. So really combining what we've done, the embrace and the liposuction along with the thread, does an amazing job. This vector right here provides even a better delineation of the jaw and the jowl. And of course, we want to maximize on the corsetting of the neck. So we're going to make this area tighter right underneath the jaw line and also the neck, the carotid angle right here. We just want to get a better delineation as opposed to a very obtuse appearance that she had earlier. We want to get a much more crisp appearance, and that's what we got. So the point is, embrace alone will do a pretty decent job, but embrace along with a really good liposuction, along with really good threading, the synergistic effect is, can't be beat. And when you do go do your consultation with your surgeon, make sure that he understands how to combine all these things to achieve a good synergistic effect that will last a long period, provide a very natural result, and foremost minimally invasive so that the recovery time is quick as well too. How are you doing so far? You doing okay?
Perfect.
So she's a very good patient. Yeah, give me a big smile. So what we want to always achieve is throughout this whole period, we want to make sure that all the musculature, all the movements are completely intact. And that's the best thing about doing it on the local. You can always monitor all that along the way and know that when the patient wakes up or when the patient is done with the procedure, they'll be able to get out here and with full functioning of their muscles and so forth. Okay, great. Thank you.